Hi, everybody. We are just getting ready for a live here to talk about the importance of folic acid intake. All right, making sure that we're all set up on Instagram, Facebook, and YouTube. All right, we are ready to go. Hi, everyone. I'm Liz O'Donnell. I am the Director of Education here at Push. And most importantly, I am Aaliyah's mom. My daughter Aaliyah was born still on December 1st, 2020. And I am here as the Director of Education in her honor to hopefully teach and just impart as much information to pregnant people as possible to keep them safe and healthy during their pregnancy. And I am so delighted to have Dr. Audrey Gaskins here with us today. She is a professor of epidemiology at Emory University. And I'm excited for this conversation about folic acid. Folic acid Awareness Month was, I believe, was it back in October or September?
I think you're right. I think it may have been October.
Okay, maybe October. So we didn't get a chance to talk then, but I'm so happy to have you here now, Dr. Gaskins. Thank you so much. Do you want to further intro yourself? Anything I left out?
Sure. No, it's great to be here. Thanks for having me. As you mentioned, I'm at Emory University, and most of my research is on how diet and the environment influence human reproduction. And so I study everything from couples, trying to get pregnant and looking at aspects of their reproductive health all the way through, normal pregnancy outcomes, adverse pregnancy outcomes, and then a little bit, forward looking in terms of the outcomes of the children.
That's great. And, I found you, and I think we talked about this, but just so that everybody knows, when I look to invite people on for, discussions and talks like this, I'm often looking, at different journals, and I saw that you were a part of an article, and I pulled up the name here: Maternal Pre-Pregnancy Folate Intake and Risk of Spontaneous Abortion and Stillbirth. And so I had kind of, read through that a little bit and just thought it was really interesting, and honestly not something that I had thought of about how folic acid intake could affect or impact that. But before we really start talking about the stillbirth prevention links, if there are any, I'm really curious as to how folic acid kind of became a standard recommendation in prenatal care. I know that it was one of the first things that I started taking even before I was pregnant. I had always been taking a supplement, and I know that it can be difficult to add things in as standard recommendations. So what's like the backstory on that?
Yeah, sure. So in the 1980s, the late 1980s, there was a large trial that was done to look at the efficacy of a high dose folic acid supplement to prevent birth defects. And this was done in Hungary, and they showed an overwhelmingly positive impact of a folic acid containing supplement on much, much lower risk of having a child with a birth defect. This trial was then repeated among women who were not high risk. So originally it was done among women who had had a previous birth defect. We know they're at higher risk. And so then they repeated it and showed that again, that it was protective. And so in the early 1990s in the US, and I think in 1992 exactly, was when the US formally came out and recommended that all women who are pregnant or capable of pregnancy take this 400 micrograms per day of supplemental folate. And then, in the kind of mid 1990s, the US started fortifying their food supply with folic acid. So they started putting folic acid in grain products, again, to also try and prevent birth defects, given, again, the results of those trials, with the idea being that over half of births at the time were unintended. And so the supplement or, the fortified food would help the women who perhaps were not planning pregnancy to also obtain those folic acid levels necessary to prevent a birth defect, as opposed to relying solely on supplementation.
And so so the recommendation that you just stated, is that just the basic, like when we purchase the supplements, like one of those, I mean, I actually have them here on the table. One of those is the recommended amount daily?
Yeah, so the recommendation is still 400 micrograms per day. But actually, most prenatals have a higher dose. So a lot of prenatals have anywhere between, I would say, 400 and 800 micrograms per day. Again, most often it's folic acid, but now a lot of prenatals have a combination of folic acid and methylated folate, which again has become more popular in recent years. A lot of prenatals have a slightly higher dose because studies like mine have shown that higher levels may actually be even better in terms of preventing pregnancy loss and helping women get pregnant and being related to better pregnancy outcomes. And so again, there's little downside as we'll get into of slightly higher folic acid doses. And so I think they're kind of just hedging their bets and putting a little bit more folic acid with the assumption that this could be beneficial, so that also everybody's meeting that 400 microgram per day recommendation.
Yeah. So, okay. So you just hit on a lot of things that I have questions about. So I guess I'll start with, is it possible to have too much, like to exceed, and what would the repercussions of that be?
Yeah, so this is a pretty hotly debated topic. Right now, the upper limit that's set by the USDA for folic acid is 1,000 micrograms per day.
Okay.
And so, if you wanted to be extra safe, extra careful, 1,000 micrograms per day would be what we recommend being the upper limit. So not consuming over that. That being said, there's very little evidence, in my opinion, of adverse effects of a high intake above 1,000 micrograms per day in the short term on any sort of pregnancy or adverse birth outcome. If anything, in certain subgroups of women, getting above 1,000 micrograms per day may be even more important, if not necessary. For example, there are certain polymorphisms in people's genes that are very common, but they decrease your body's ability to absorb folate. And so because of this, you need even higher levels of supplemental folate to kind of overcome this natural inability to metabolize it. Most people don't know, what their specific polymorphism is. And so again, consuming 1,000 micrograms per day might be advantageous if you suspect you may have this, or, you just want to be safe. Again, I would say the only downside, getting at the second part of your question, is when you don't metabolize all of the folic acid that's in a supplement, there's what's called unmetabolized folate that's in your bloodstream. And eventually you excrete it. Folate is a water-soluble vitamin, so it doesn't get stored. It's just, whatever you don't absorb, you excrete it. But there's some concern that these levels of unmetabolized folate could have some adverse impact on health. And again, this is largely just hypothesis right now, not actually proven. But
are there being done, or is it kind of like that waiting period of, oh, we need someone to start a study on this?
Yeah, no, people are actively looking into this. And, it's a challenging question to address because, as you might imagine, the women who are taking high levels of folic acid also tend to be the women who may have had a previous adverse outcome. And so they're taking it with this in mind, or, are super, health conscious and want to do everything that they can. And so that makes it challenging to study because, it may be linked to, higher risk of autism or some of these like child health outcomes that also may just be more likely that the women themselves who are taking these high levels, may naturally be at higher risk for. So it's complicated. And we're still waiting to see.
Is it best for someone to ask their doctor how much they think, given their medical history, what would be inappropriate? Or do most doctors just kind of say, oh, just take one supplement and you're good to go?
It really depends on the doctor, but, there's going to be no harm in asking for their input, particularly given that they would know your medical history better. Definitely trust your doctor's advice over Instagram, TikTok. There's so many supplements that are pushed on women nowadays, and it's pretty alarming kind of the range of which they contain folate and all of these other micronutrients and other supplements.
Mhm.
So yes, definitely getting their input and doing a fact check on things that you hear from people without, background in that area is always advisable.
I'm so happy you said that because, we do definitely see a lot of supplements on social media these days, especially I know on TikTok. I mean, it's absolutely insane. And it seems like a lot of them or are not regulated very well.
Yes, correct.
And so one of the things here at Push that we always, want pregnant people to know is use your mom voice, be empowered and feel, listening to talks like this, we want people to feel more empowered to ask these questions and not feel like they're silly questions or, oh, maybe I should already know that. I'll just Google it or I'll look on Instagram. So I'm happy that you said that because that is something that we at Push, we really try to get people to do. Is to just, feel great about asking questions to their doctors, even if it's
Yeah.
something like this.
Yeah.
Okay, so now let's go back to kind of what you said when you mentioned increased intake of folic acid. I also heard you say and mention pregnancy loss and outcomes. So, we are a stillbirth prevention organization. We are founded by families that all experience stillbirth. And so we really try to focus a lot of our information on the what I wish I knew or what would have been helpful back then. And so when it comes to folic acid intake, I mean, as I said, the article that I saw really caught my eye because I did not really factor this in. I thought folic acid was mostly important before you got pregnant or right in the beginning. So any light that you want to shed on any of this, especially from the stillbirth prevention lens, would be huge.
Yeah, and I think what you just said is accurate. So I got interested in folate. This was actually the study that you're mentioning was my thesis, and so my entire thesis was on folate and pregnancy loss and early pregnancy outcomes. And so it definitely holds a near and dear place to my heart. And I got interested in it because folate plays such a vital role in the body in terms of repairing different genes and helping with oxidative stress and inflammation. And it's heavily involved, like I said, during cellular replication processes. So again, human reproduction, cells are, replicating exponentially. And so it makes sense that folate would play a pretty vital role. And one thing that we saw in a couple of different studies, so a couple of different cohorts, was that women who consumed higher amounts of folate in that preconception period leading up to pregnancy had a much lower risk of spontaneous abortion or miscarriage, which would be losses prior to 20 weeks.
Okay. Yep.
When we looked in a cohort of women undergoing infertility treatment, specifically in vitro fertilization or IVF, even among that population where, everybody's planning pregnancy, everybody's taking some sort of, micronutrient supplement, more or less. We saw even in those women, those that had a higher folic acid intake, their embryos developed better. Those embryos fertilized, were more likely to fertilize, and then they survived better once they were transferred into the woman. And so again, when we looked in kind of the larger study that you mentioned, which was in the Nurses' Health Study, we had a large enough study. We had, I think over 100,000 women that we actually were able to look at such a rare outcome like stillbirth. And we, again, saw a suggestion that the, preventative effects of folate on pregnancy loss extended even to later in pregnancy. And this was somewhat surprising to us, again, because there wasn't much in the literature on this.
Yeah.
But,
Way to go.
well, one, we saw the strongest signal with kind of what we would call early stillbirths. So stillbirths that were happening like right after that 20-week cutoff. So between 20 and 27 weeks gestation. But, once we started thinking about the plausible mechanisms, we know that folate is, related to better, embryo development. So perhaps you're creating an embryo which turns into a fetus, again, that just has more potential to be viable. And then 2, we know it's heavily involved in placentation. And so again, creating a placenta that may be, more viable, more healthy, more sound, again, that would kind of be more compatible with extending the pregnancy along. And again, these are all hypotheses. These were observational studies, but it's hard because, as I mentioned, I mean, luckily stillbirth is a rare outcome. We don't want it to happen. It's a horrible, devastating endpoint. But because of that, it's really hard to study because we need such large populations. And then when you talk about something like diet, where we have to ask people to kind of self-report or take a blood measurement, it gets really challenging to do studies like that.
No, that makes a lot of sense. And it's, as rare as stillbirth is, I mean, for us, I did share this all the time when I talk to doctors. I didn't know that stillbirth still happened until it happened to me. And to know that, well over 20,000 families are experiencing it. I mean, if it's something like, okay, folic acid, we know that it could help with this. I mean, that's important for people to know, no matter how rare, right, the outcome is, because unfortunately it's still happening. So keeping that in mind, are there like links with, okay, so if I'm at an increased risk for stillbirth for whatever reason, are there ways that folic acid can help, I don't want to say like lower my risk, but just help support in making sure my risk isn't being increased or anything like that?
Yeah, I mean, we haven't addressed that specific question before, but there's no reason to believe that women who have had a previous stillbirth wouldn't benefit, to the same extent or more from taking folate. The other thing I wanted to mention, and where my research kind of started heading after that initial paper, is we also, one of the questions we got was, why do women need such a higher amount of folate than that standard 400 micrograms? Because we were really seeing benefits at 800 micrograms up to 1,000 micrograms per day. And the question we commonly got asked was, why do they need such high levels? Why isn't 400 enough? And another thing we started seeing, because a lot of the studies that I was using to investigate this question were also measuring environmental chemicals, things like endocrine disrupting chemicals or air pollution, things that we're all exposed to. We saw that
alarmingly increased rates.
Exactly. We saw that folate was actually offering some protection. So among women who had higher exposure to something like BPA or phthalates, these endocrine disrupting chemicals, if they also had high amounts of folate, it could offset some of the negative outcomes. Same thing with air pollution. Women who had higher exposure to air pollution, if they also had a high level of folate, this would, again, alleviate some of that adverse effect. Wow. And so, again, we started to kind of think, that interaction and that increasingly common, you have higher exposure to all these chemicals. It could be competing for some of the folate resources. And so, again, having a higher dose to counteract some of those may be what's going on here. But again, we're still looking into it. But we've seen this with neural tube defects. We've seen this with other birth defects. We've seen this with pregnancy loss. There aren't any, to my knowledge, studies specifically looking at stillbirth, again, because as I mentioned, it's hard to study, but it wouldn't surprise me if we also see that same kind of interaction.
Well, I feel like I've seen a lot of articles. I'm actually getting a master's in public health right now, and my very first class was about the environment, and I'm doing everything for this degree in the lens of stillbirth prevention, right? And I was just seeing and reading so many articles about environmental factors increasing the risk of stillbirth. So it's helpful to hear what you just shared, even though the info, isn't completely solidified yet, to just kind of make those connections and think, okay, yes, we have these environmental challenges that could be presenting risks, but perhaps if we can increase our folic acid intake, that could help a little bit. So I'm curious to know, I'm sure we have some people that will be watching this that, maybe taking supplements is challenging. I know, people sometimes just cannot take a pill. And so what other options are there if, someone would not be able to tolerate a supplement? Even if like food examples, anything that you might.
Yeah. So, the best example would be a ready to eat breakfast cereal. Those are already fortified with a lot of great vitamins and minerals. Folic acid is one of those.
Yep.
Oftentimes, like a standard serving of cereal would give you your recommended daily amount of folic acid. Any kind of grain product, like I mentioned in the US, is fortified. So again, it's interesting, when the low carb diets became really popular, we got a little bit worried because women weren't eating, or some, subgroups of women were eating as many grains. And so there was this concern that there may be this increase in things like neural tube defects or other things that have been kind of conclusively linked to folate intake. But there's many other ways that you can find it. I've even now seen it in, like the powdered drink that you add to your water. So there's a lot of different ways you can get it if you don't want to take a pill.
Okay. Yeah. And I know that the pills that I have are super tiny. They're just little tiny pills. So it is always good just to have those alternatives if someone, would not be able to tolerate a supplement like that. Before we wrap up, I also just want to ask you, are there disparities that you're aware of between different races and how folic intake can affect a pregnancy, or is there research on that?
Yeah, that's a good question. When you said that initially, I was thinking about, like, I'm sure you've covered on some of your work. There's huge racial disparities in incidence of stillbirth.
Yes. Yes, there absolutely.
I'm not aware of any, stark differences in like supplement intake between race ethnicities. It's come up again somewhat recently that Hispanic women could be at higher risk of neural tube defects because they're consuming more corn-based flour that's not fortified with folate, as opposed to the grain-based flour that a lot of other populations consume. So there's been a push to also fortify this corn or masa flour. But yeah, it's interesting to think about how that might relate to stillbirth. That's a great question.
Well, and it seems like there's still so much work to be done here in just folic acid intake and linking it to stillbirth. So yeah, I mean, I feel like now there's so much focus, especially on Black maternal health, on topics that just have not been researched or explored yet. So I was curious. So thank you for answering that, even though I know there might not be an answer. Hopefully that will be something that's studied. Is there anything else that you think is really important for, pregnant people to know about the supplement for their pregnancy?
You hit on my favorite nutrient, which is folic acid. I think that's by far the most important. But I would say the second one is probably omega-3 fatty acids. Okay. Again, there hasn't been as much research looking out at, something like stillbirth. But at least we've seen in our studies looking at earlier pregnancy loss that omega-3 fatty acids seem to be really important in terms of preventing those outcomes.
Yeah, I was a part of the midwife group at my hospital where I had Aaliyah, and one of the main food group things was the fish for omega-3s, and that's also a supplement that I've been taking for years. So that's
and actually in that case, like getting omega-3s from foods is preferable because. For many reasons. But if you can't consume seafood because of dietary preferences or a lot of different reasons people don't want to consume seafood, then a high dose omega-3 fatty acid supplement would be preferable.
Well, thank you so much, Dr. Gaskins, for being here. I appreciate this. I feel like this is a topic that many people are not really going to associate with stillbirth prevention. So I'm happy that we were kind of able to share some of your work and some tips for people in their pregnancy journey. Because, we encourage everyone to be here. This is not only for people that, have experienced the loss. This is for everyone looking to have a healthy pregnancy. So thank you so much for being here. And if anyone has any additional questions, feel free to reach out over DM and we will try to get you an answer. And always remember, if you have any questions, please, about your pregnancy right now, please, please, please consult your doctor. We're just here sharing some helpful tips, but it's always best to go to your doctor with any concerns. So thank you so much, Dr. Gaskins. I hope we can have you on again sometime.
Yeah, this is great. Thanks.
All right. Bye, everyone.